We are live. Welcome, everybody. This is Dr. Ashish, Friday live show, and I'm so pleased that we are consistently doing this because sometimes it gets off the radar and we are not able to keep it up. But thank you for everybody also who joins us or listens to the replays afterwards as well. So you can always drop your questions even on the replays, and I'll try my best, either me, and if the question is for particularly for the guest speaker, then for them to answer it for you. And ask a question now, or whenever you wish to catch it or happen to catch it, then do it then. Today, we have a wonderful expert, Mr. Andrew, who is going to talk about musculoskeletal health. And he's going to talk about what he does is best. I will ask him. And let me know also, just always let us know if you can hear us, if you can see us properly, so that it is, useful and we are not just talking to ourselves. So thank you, Andrew, for being here. And it is wonderful to have you here on the show. And I think osteopathy is a great paradigm and the way it supports, health. So welcome. Tell us what you do, how you do it, why you do it. Why is my question. Why do you do this?
Well, thank you for having me on. So I'm an osteopath. So it's basically I treat musculoskeletal health, so joints, muscles, nerves, ligaments, all this sort of thing. I treat with gentle hands-on therapies. So a mix of massage, joint mobilizations, joint manipulations, all sorts of different bits and pieces to allow me to take people whose muscles are perhaps working too tightly or holding things under too much tension, and allow their body to move better and more pain-free.
Yeah. So how long have you been doing this?
Oh, I've been doing this now for about 7 years, I think.
Right.
Graduated from Swansea University a little while back.
Okay.
Quite well, increasingly longer the more I think about it, but
Yes. And what interested you in osteopathy in particular, or health in particular, to become a health practitioner? Because when I was studying, herbal medicine, I was one of the mature students, because more people, they have some kind of day job and this becomes like a secondary vocation for them. So how come you were interested in this?
Well, originally I quite liked the idea of being a forensic pathologist, sort of being the
More
slightly odd
thrilling.
person, being the sort of slightly odd person in the basement of all the police shows, sort of figuring out problems with the body and figuring out sort of cause and effect in that sort of way. But that led me on to thinking, well, there are more problems that happen during life as opposed to just after life. And so that led me into thinking about surgery and sort of more allopathic medicine, and but crucially sort of hands-on medical treatment was what I was interested in. And so from there I got thinking about surgery, but by the time I thought about that, it was a little bit late for me to join that as an undergraduate. And so I was looking around for what else to do. And well, I did quite a bit of theatre and performance back when I was younger, and still a little bit now as well. But at the time, we were getting ready to perform a piece called the St. John's Passion by Bach, which is a great big book about sort of that thick. I was just holding this book in place for hours at a time rehearsing, and my entire shoulder just locked and became very uncomfortable.
Oh.
And so somebody recommended I go see an osteopath.
Right.
And yes, somebody recommended I go see an osteopath, and so I did. And it just sort of all clicked together for me, this idea of, well, this is what I want to do. It's hands-on, it's sorting out problems with the body, it's figuring out that cause and effect. And so I looked around for courses that were offering it at university that I still had time to apply for. Blanket applied to every place that offered a course, and got accepted by all of them in the end. And finally settled on Swansea. Swansea is the one that I wanted to go for.
Yeah. And how long was the course? I mean, I know, but I want you to share it also, that my information, some of these things may be a little bit older information, so it's good for people.
So it's a 4-year full-time course.
Yeah.
I believe there are some places still that you can do it as a 5-year part-time degree as well.
Okay. Right.
But yes, I did the 4-year undergraduate master's course. So
Yeah.
it's essentially a bachelor's 3 years and then a master's year, all packaged together under one degree.
Ah, right. Okay. And what else can you do following from this? If you want to follow on, what else could you go into?
Well, I could fairly easily transition over to any of the various specialities of osteopathy. So there's cranial osteopathy,
Hmm.
zoological osteopathy for animals.
Oh,
There's my particular speciality, which is laryngeal manipulation.
yes.
So that's taking the principles of osteopathy and applying it to the throat and to the voice.
Okay.
Um,
I met someone recently at one of the events, and this lady, I believe she's 60, at least 60 plus.
hmm,
And she has got, what is it called? Collapsed or paralytic, I think paralytic, either esophagus or I think paralytic esophagus.
hmm.
So you are talking about laryngeal, so it is not the same thing. But is that something you treat, or is that osteopaths can help with that as well?
Typically, with sort of neurological conditions, it's not something we're going to be able to help with because
Right.
it's not. It depends on what is causing the issue. If it's a matter of a mechanical problem that is pressing onto the nerve, that's something we can potentially help with. But if
Hmm.
it's something wrong with the nerve itself, with the nerve structure, or with the function of the nerve, that
Yeah.
is something that tends to need additional treatment beyond what we can provide.
Yeah. Yeah. So tell me about this specific, this how you are specializing in larynx. What kind of things you see, and because I don't know much about it, so I would love
Hmm.
to for you to explain a little
Yes,
bit.
it's not a particularly wide speciality. There's not many people who do it.
Yeah.
But essentially, the voice itself is a muscular system. You have to use muscles around the throat to alter your voice and to provide yourself with a voice as well.
Hmm.
And so we can take the principles of osteopathy in finding areas where that things aren't moving as well as they should be, and treating them to help that area move more comfortably, move more freely, finding
Yeah.
areas of muscular tension and releasing those, and making sure there aren't sort of areas where basically the voice box isn't able to move comfortably. So we look through the base of the tongue and through the jaw,
Hmm.
make sure there's not any tension through there. Look down through the front of the larynx on both sides there, see if there's a tension that might be pulling the larynx over to one side as opposed to the other, or might be twisting it slightly. We look further down into the ribs and into the diaphragm as well, because we want to see if there's any issue with breath control, or if there's anything that's preventing breath being able to be brought readily to be able to create a voice.
Yeah. Yeah.
And so with that, I work quite closely with a number of speech therapists and ENT surgeons,
Hmm.
so that we can basically help people post-surgery for the throat to recover their voice,
Yeah.
or we can aid with speech therapists with taking people who are perhaps suffering with a lost voice currently or suffering with a vocal problem and
Hmm.
speeding up their recovery by dealing with the sort of physical things that are holding them back from recovery,
Yeah.
while exercise given by speech therapists helps to teach them how to use the voice better.
Yeah. Yeah. Is that something which is also helpful in other ways? Why how some maybe youngsters or even not so young people who suffer with autistic spectrum, where they are non-verbal. Is that something you also see? Is that something you help with?
That's less something we can help with, because usually if somebody is non-verbal, it's less they're not able to speak and
Yeah,
more that there's a sort of processing issue with how the sort of brain is working through things,
that's right.
that it's a choice not to speak, as it were, or that vocal communication doesn't fit their current need.
Yeah, yeah,
And so
yes.
if they are finding they were having pain or difficulty when speaking that was putting them off from speaking,
Hmm.
that's something we could help with. But it depends on the cause behind it.
Yes, absolutely. And what are the causes? Why would somebody have that kind of, difficulty with voice box? Maybe accident, something happened that way.
There can be accidents or trauma are a sort of major cause. So
Hmm.
particularly shouting. I see quite a few teachers and various people
Ah,
who spend a lot of their day talking and shouting and overusing the larynx,
okay, right.
because much like if you were going to run a marathon, you wouldn't run a marathon and then run a sprint the next day and expect yourself to be perfectly fine.
Yeah. Yeah.
The muscles around the voice do tire, and they do tighten with time.
Mm-hmm.
But also we can deal with surgical, post-surgical things. So that could be somebody who's recently had surgery for throat cancer,
Yeah.
because there is a lump that has got in the way, or there is a sort of what we call a space-occupying lesion.
Mm-hmm.
So that could be vocal polyps that have caused problems with the voice, which have recently been surgically excised.
Yeah.
And from there, we can help with the recovery through that.
Yeah.
Or there can be a number of, again, neurological conditions which can affect the work of the larynx. So things like spasmodic dysphonia, which isn't something we can, well, we can't cure these things, but we can help treat the symptoms and manage the
Support it.
symptoms.
Yeah.
Yes.
Yeah. Yeah. So I also know, and maybe people don't know, but those who are listening, that osteopathy, as we know, is a complementary, is part of complementary alternative medicine, right?
Mm-hmm.
So that is still the case, or has it
Yeah,
changed?
that's still the case. We still work very much in a complementary position with traditional, or as we call it, allopathic medicine.
Yeah. Yeah.
Um,
So you get referrals from doctors, and you mentioned you working with surgeons.
it can be a little bit more sort of individual, but yes, I work with a number of NHS surgeons
Yeah.
who they can't refer directly to me because I'm not part of the NHS sort of brand, but they can
Mm.
recommend me as part of a package of care. But
Oh,
there are
good.
places around the country, there are health boards that do use osteopaths as part of the NHS.
Hmm.
Most for low back pain currently. But as the research continues to get done, and as the sort of newer generations of osteopaths are pushing quite hard on research
Yeah.
to sort of show our effectiveness, then we are being sort of more widely used by traditional medicine.
So what do? They tell their patients, go and see this person, might be able to help you. Yes.
Yes, essentially they don't send me sort of details as much, but they say, I think this would be beneficial for you.
Mm.
These are their details. I'd recommend you go and see them.
Yeah. Yeah. That's right. Yeah, that's how generally GPs refer, or even consultants for that sake. But you
Mm.
also mentioned that there are some places where you may be part of their team as well. Yes.
Yes, there can be places. Uh, Again, it comes down to the sort of individual health board of the area and to the relationships that osteopaths can forge with health practitioners in their local area.
Yeah.
So back during it was sort of the second half of 2020 to 2021, we had a small sort of vocal clinic that would run once a month,
Mm.
which was me as a laryngeal consultant osteopath. We had our ENT surgeon and ENT sort of scope
Yeah.
technician, and we also had a speech therapist, so we could work together to help benefit the patients and speed up their recovery much quicker than any one of us could do alone.
Yeah. And where was this? At the clinic at the GP practice? Or
This was over at the hospital in Guildford.
right. Okay. Yes. Because I know, again, my things are very old. So I'm going back about 25 years or longer. There used to be a clinic, not sure if it is still running, at Whipps Cross Hospital, which is in East London. And they used to have a skin clinic, which was run by herbalists. And these herbalists, they were all appointed by the University of Westminster because it was under them. University of Westminster course has finished, stopped now. They're not doing herbal medicine degree there. That's where I qualified from. So there used to be this clinic, and only because the consultant was very much on board with holistic medicine, and he wanted to have, people who wanted to have help from herbs, for example, and see a herbalist once a week. So I know many of my practitioners, and I have sat in that clinic as well, where people are referred by the consultant and then they go and see this herbalist. But it is only far and few in between, because not every, in those days there used to be PCTs, primary
Mm-hmm.
care trust. Now we don't have those, we have other boards, right, as you
Mm-hmm.
mentioned. So yeah, I think there were only 5 or 6 clinics like that around the UK then. It
Yes.
may have changed now. So
Yeah.
how
So
many
it
do you
comes
think
down.
osteopathy clinics are there in?
Uh, I'm not sure how many osteopathy clinics there are currently with sort of health boards around the country.
With the
Last that I
NHS?
checked, there were about 2 or 3 sort of health boards that offered osteopathy as part of their treatment.
Okay. Okay.
And so I think that there's probably that number's probably gone up a little bit by now. So I'd imagine there's about maybe 5 or 6 health boards
Yeah.
across the country that use osteopathy.
Yeah, yeah. So it is very few, and I feel there should be more because it is such a great paradigm to help people,
Mm,
and I also feel that this is a little bit more help as compared to some other. Um, for example, with physiotherapy is great, and if we can then use osteopathy with it, because some patients need it that way,
mm.
it can work really well.
Yes. The thing with a lot of particularly hands-on therapies and complementary therapies is that they can be very individual compared to
Yeah,
sort of allopathic medicine and to sort of herbalistic medicine as well. And
yeah,
that you can see 3 different osteopaths, 3 different physios, and they'll each have a slightly different way of treating, and that may not suit you all that well.
yeah.
So it comes down to a matter of finding the right therapist for you, for one thing, but also finding the right treatment modality for you. So, of course, as we mentioned there, physiotherapy compares quite similarly to osteopathy, and as time goes on, we become more and more similar.
Yeah.
But particularly, there is quite a large divide between NHS physiotherapy and private physiotherapy,
Mm.
and that's basically because the way the NHS has to run is that it has to be quite prescriptive with what's given,
Yeah. Strict
because it has to be
guidelines.
able to, yes, it has to be able to sort of fit into the insurance code to be able to run the NHS as the business that it is.
Okay.
Which means that if you come in with X condition, you will receive Y treatment package,
Yeah.
which can work very well for injury, for illness, all these sort of things, but doesn't work all that well with musculoskeletal injuries or musculoskeletal trauma,
Yeah.
because that can be extremely individualistic. It can be very different um, in terms of how people will present or how they'll react to treatment.
Yeah.
And so it's a sort of slightly tricky one because of course, no, I'd love the NHS to be able to use us more often,
Yes.
but it does also mean we would be quite a bit more constrained by the way that the NHS has to run.
Yeah. No, NHS has to broaden its mind. So we don't want therapies to be constrained. Of course, there has to be guidelines and it should be safe for everybody to use for sure. There has to have guidelines for everything, like we have with herbs, like we have with natural medicines, of course. But it is, if it is more available to people. And I also feel sometimes, but as you just clarified, because on the NHS, the way certain systems are, even when they are part of NHS, they're very restrictive, and it doesn't then benefit. And health is only subjective. We don't have two same people who have got exactly same musculoskeletal problem. Everybody's health is completely different. So it would be, yes, it would be wonderful to be able to do more of it, right?
Yes, yes, I think that most people would benefit from seeing a complementary health therapist for musculoskeletal health
Yeah.
fairly regularly, because I mean, we see dentists twice a year. You see your optician sort of fairly regularly as well, but people don't tend to do the same for their
No,
musculoskeletal healthcare or the rest of their body.
that's right.
And so that means that problems can build up and build up gradually over time. They can seem fairly minor when they begin, but that creates a little sort of trickle effect, and then that gets bigger and bigger and more complicated. So that eventually you get to the point where your body can't adapt
Mm.
any further, and that causes a problem or an injury that sets you back quite a bit.
Yeah, yeah,
Once it's become a problem once a problem has become a problem, it's much harder to fix than if you get
yes.
it earlier
Yes.
on when it's
If you
still building
started,
up and becoming uncomfortable.
yeah, absolutely. It is the sooner you can start, or not just only start when you have an issue, but do it as a preventative medicine
Yes.
as well. Go and see an osteopath once a year at least. If you're fully
Hmm.
healthy, 100% healthy,
Yes,
then
because it just means that we can identify things that could potentially become a problem later on and
mm,
correct them now before they become an issue that then leads you to being in pain, uncomfortable, and having to come and see me for a number of sessions to get yourself sorted.
yeah, absolutely. So, Andrew, tell me, or maybe you have an example of this. Do you find or have seen this in practice where, it is yes, musculoskeletal issue, but there is more to it. There is more mind involved, and how, you know, you kind of address that. Have you
Oh,
seen
yes,
these
plenty of
situations?
times. I mean, nobody that comes in purely with an issue with their muscles.
Yeah.
Basically, every problem that we deal with this idea of a biopsychosocial model. So that we look at the biology, which is what is physically wrong with the structures and the tissues.
Yeah.
We have to consider the sociological aspects of it and how that person views pain, how they view injury, how they,
Mm.
how they have been sort of taught by the people around them to act while injured. And then the psychology of it as well is that are there things that mentally might be causing further discomfort or might be limiting them in a way. So, for instance, a little while back, quite a few years ago now, I had a patient come in with a fairly simple sort of lower back problem, a slight increase of tension around the right-hand side of their lower back, and a couple
Mm.
of joints in their lower back that were just being pushed together in quite an uncomfortable way.
Yeah.
Now, biologically, that's a fairly simple thing to sort out. You relax the muscles, you move the joints apart, and everything sort of follows on then that as those joints are able to move more comfortably, it becomes less painful, and
Yeah.
you're able to continue on from there. However, because their mother had previously been diagnosed with a lot of osteoarthritis and had been in a wheelchair much earlier on, and had
Yeah.
started, and that whole journey for their mother had started from that initial bit of low back pain. They had
Yeah.
a lot of sort of psychological stress, a lot of emotional stress around this problem and around it being touched and treated,
Mm.
because there was that fear that if something went wrong or if this wasn't sorted, they would also then be in a
Yeah.
wheelchair,
In a
have all
wheelchair.
these problems later on.
Yeah.
And so a large part of treatment isn't just the hands-on therapies to help relax the biological things. You have to deal with the psycho and the social aspects as well,
Yeah.
which often I find just means basically just having a bit of education within your treatment.
Mm.
So talking through what it is that's caused a problem, what that problem is, and basically demystifying pain,
Mm.
because you and I, we've both been trained in the body, we both understand a lot of the medicine, and I
Yeah.
think it'd be quite easy to forget that not every person knows what their body is made up of. They don't know their anatomy, they don't know how
Yeah.
the body moves or how it's meant to move, or what an injury is
Yes.
to an aspect.
Yeah.
And so I find helping people through with understanding what their body is currently doing, the things that will potentially aggravate their pain and the things that will relieve their pain,
Mm.
as well as helping them understand that, with a sort of simple problem like that, sort of small joint problem in the lower back, that's unlikely to lead to them having a sort of long-term injury or a long-term problem,
Yeah.
and taking the fear out of the injury.
That's right. Yeah. Yeah. That's a great example, because I have had patients, where the issue, what they presented is lower back pain. Okay, we started
Hmm.
investigating and having discussion and realizing that it is more, as you mentioned, psychosomatic, as well as the fact that she's not having great intimacy, so it is
Hmm.
manifesting as lower backache issue as well.
Hmm.
But it is wonderful to see that you are doing this, and I know that osteopaths do this. This is just for people who don't know that how maybe osteopaths work, to explain this a bit, so that, because especially to do with pain, and we know that pain is probably most misunderstood phenomena. We still don't fully understand how pain
Hmm.
is, and pain is so subjective to people, right?
Hmm.
One person can withstand so much pain, whereas other person might be shouting their lungs out.
Hmm.
So also, as you mentioned, how you tell them that this issue is not going to cause a major long-term damage,
Hmm.
to inform them. So yeah, I guess my question is, how do you, it's also a kind of counseling them or telling them, not counseling as a whole
Yeah, it's not
paradigm.
officially counselling them, but um, use that sort of sense of counselling as a verb, as how to take a person from one sort of mental position through to another more healthy sort of position for growth.
Yeah.
Um, so that can be done in a number of ways. It can be done by simply sitting down and just talking a person through basically showing them with sort of diagrams or drawing, this is what is physically going on in your body. This is what is happening with this area.
Yeah.
So when you do this movement, this happens. So for instance, with that lower back problem, you have sort of two joints sitting on top of each other, and usually they can move around just fine. But if the muscles are tight, they're going to be pushing them down into each other, so that when they move, that's going to be causing them to rub against each other, and that manifests as sharp pain for you.
Yeah.
And so when you go to do twisting movements in particular, those two are going to bump together, and that's going to cause a sharp jab of pain. It might even irritate the sciatic nerve or some of the other nerves around the area, because everything is built up, which sends a pain down the leg, all these sort of things. And I think sciatica in particular is something that people tend to panic about, because it's something that gets sort of thrown around as, that's sciatica, that's sciatica. But crucially, sciatica isn't a diagnosis.
Right.
Sciatica is a symptom.
Yeah.
Because all it means is pain in the sciatic nerve. And, that's not a diagnosis. That's not a cause of problem. That's a sign. It's a symptom of things. And so helping people understand that, your particular experience of sciatic pain will be different to somebody else's. And this can feed into then talking about mental health, because various conditions such as depression or when your hormones begin to get sort of deregulated, it can affect your responses to pain. So you can end up experiencing more pain from something that you would usually find comfortable. Or not necessarily comfortable, but something which you wouldn't experience as that severity of pain. But then there's also the aspect that pain, when you're in it for a long time, even if it's a very small sort of manageable amount, will affect your mental health, and it'll affect your physical perception. So you'll experience more pain through that sort of feeling of perception, which then builds a limiting factor in the mind. Then you think, well, I can't do that because it will create pain. Or, I have this pain, and that becomes a normal part of your experience.
Yeah. It is. Yes. Thank you for explaining that, because pain is something, and also people think pain is the problem. Pain is only a symptom of something that is going on much deeper level.
Pain is basically your body's way of signaling to you that something is going wrong.
Yeah.
And something needs to be sorted. Now, of course, sometimes that system can be disrupted, and you can have pain without a cause necessarily. Or without a cause that sort of links together and makes sense. But that doesn't tend to be sort of a very regular thing. That can be quite a rare circumstance to have. So usually when you have pain, it's your body telling you that something is wrong, or that you need to pull back from something. Because your body is trying to stop you experiencing more injury.
That's right. Yeah, body is trying to actually protect you, but most people are like, oh, I'm in pain. And also, I was talking about painkillers yesterday on my Facebook post, because so many people, just at the drop of hat, they would take a painkiller because they don't understand. And also, so many people are scared of the pain. This is also a learned behavior as well, as you learn with, being a child, and every time you had a pain, somebody gave you a painkiller. So you learn that every time you have even a teeny bit of pain, you take a painkiller, rather than understanding how body is, and also knowing then, that how can you adjust certain things. Maybe you didn't sleep very well, maybe pillow was too high, maybe your mattress is not very well, because all these is causing some kind of pain, right?
In a way, there's also societal pressures around pain as well. So, for instance, with headaches or with sort of lower back pains, this sort of thing, your ability to work and your ability to go about normal life, you have so much pressure put onto that when you are experiencing pain, you have been sort of taught by society to, sort of ignore that or suppress that as much as you can, so that you can continue to function normally. And so, I think as your post said yesterday, you have a headache, you take a painkiller, because it means that then you can try and get on with the rest of your day without pain. But yes, just you say pain occurs when the body has done something, or something has happened within the body that is outside of its normal, and your brain is trying to protect you from it. And so part of this comes in with something the brain has, which is a sense called proprioception.
Yeah.
which is one of our many, many, many senses. And I don't have to explain this to you, of course, but for some viewers at home,
Yes, please.
um,
Yes.
that proprioception is your brain's understanding of where your body is in relation to itself. So that means you can close your eyes and you can touch your nose. And I'm not poking myself in the eye or sort of hitting myself in the face or anything like that, because my
Yeah.
brain understands where my hand is in relation to the rest of my body. And it does this through a number of little organelles throughout the body, which are little tiny bits inside our cells that
Yeah.
tell the brain how much tension things are under. But this sense is incredibly dynamic. It's something that can be shifted about a lot because your brain receives huge amounts of information at any one time. And so
Yeah.
information that doesn't particularly change gets ignored. And so we see this with, and I have to try and think of the least disruptive one of these to use as an example. It's the reason why you don't see your nose until somebody points out that you don't see your nose normally. And then suddenly your nose is in your vision for the next couple of minutes. And that's because we have this phenomenon called habituation,
Yeah.
which means that your body will, your brain will begin to ignore stimulus that don't change or don't sort of have that
Yeah.
much of an impact on everyday
Yeah.
life. And so we see this all the time with muscle tightness. So that our posture, and I'll come back to this idea of posture later on because I have a lot of thoughts on that.
Yeah, sure.
But posture, we talk about posture a lot and how we have to sit properly and sit in a correct position. And the reason for that is that we're looking for a position that will cause the body the least amount of tension to build up. Because if I'm walking around with my head forward all day, that's going to tighten the muscles through the front of my neck. That's going to tighten the muscles at the back of my skull to bring my head up. And all these things are going to tighten and tighten and tighten because our body is having to hold those muscles in place. And it becomes much more energy efficient for the body to simply leave a muscle tight as opposed to have to contract and relax, contract and relax. And so, one day we'll be sleeping and we'll wake up with a sore neck and think, oh, how have I done that? I must have slept funny.
Yeah.
And the reason for that sleeping funny is because your brain has forgotten those muscles were tight. The brain has forgotten those muscles are pulling the head around into a position that isn't fully relaxed.
Yeah.
And so it makes it much easier for for those little joints in the neck to bump together or for the muscles there to overstretch.
Yeah. Yeah.
So bringing that back around to posture, we talk about bad posture
So
quite a lot as being...
You must see everybody walking around with bad posture.
Well, you see, this is the thing that we talk about bad posture as if it's this sort of monolithic thing that you have bad posture. But the idea of postures being good or bad, I think, is a bit reductive because, you can sit curled up like a shrimp on a sofa for, you can sit there quite comfortably and quite happily for an hour or so. But the important thing is that you need to be able to give your body a full range of movement. And so, sitting curled up or sitting looking down at your phone for hours at a time, that's going to start causing muscles to tighten up because your body is saving you that energy of contracting and relaxing the muscle.
Yeah.
And so when we talk about bad posture, you can sit slumped at your desk quite happily for an hour. That's fine. But, the next hour you want to be in a different position. So you want to be sitting more upright or basically moving yourself around because flexibility is one of the most, it's one of the things we lose most as we get older.
Yeah.
Because basically if our body doesn't need to give us a full range of movement, it will save the energy that it would spend on keeping those muscles relaxed by simply tightening the muscles and restricting your movement.
Yeah.
And so when people talk about bad posture, I tend to think it's a bit reductive because you can sit in any position you like. The important thing is that you are moving regularly.
Yeah. I think it's probably the idea of balancing it. So as long as even if either because of your jobs, for example, I have dentist friends who are, as part of their job, they have to bend quite a lot. So, lower back can become an issue. But as long as you're balancing it out and as long as you're aware that this is part of either your work or otherwise you do it and you are counterbalancing it, so you are making body a little bit more flexible, you're doing exercise accordingly, or you're doing yoga or something to counterbalance it. I think that's the key. The key with everything is conscious, to be conscious of what is happening to you.
Yes. And yes, this is comes back to this idea of movement as one of the principles of osteopathy is this idea that movement is medicine and that moving
Nice.
your body around will help to basically increase your health.
Yeah.
That's because, we want our bodies to be as flexible as possible. We want them to be as mobile as possible within safe limits.
Yeah. So so you are saying in a way that flexibility is more important than strength.
Personally, I think so, because strength you can build up at any time. Flexibility you can build up at any time as well. But strength without flexibility means that your joints aren't moving, because if I have, two joints that are apart and I build up the strength of those muscles, then, if they're tight, I'm still using perhaps 50, 60% of my muscle rather than the whole amount of the muscle.
Yeah. Yeah.
Because flexibility when it comes down to it, is how much a muscle allows itself to be stretched.
Yeah.
And if you have muscles that have grown tight over time, it's not the entire muscle that's going to be tight. It's going to be sections of it, or muscular units that are going to be tight within that muscle. And so that may be, sort of 10% of the muscle is being contracted at all times, which means that your body can't stretch it very far, because that 10% thinks it's relaxed.
Yeah.
And so you try and stretch it, and your brain goes, you're stretching too far, you need to pull back, or you're going to tear, because that part of the muscle thinks it's being stretched much further than it is.
Yeah. Yeah.
And so if we take this idea and apply it to the whole rest of the body, and you build up your strength, and you build up all the sort of strength in your ability to move, and your ability to lift heavy things, or your ability to be able to sort of move large amounts of weight. What can happen is that if you just keep working on strength and keep working on strength, your muscles are going to tighten and tighten and tighten, and you're going to lose more of your muscle functionality, because your muscles are holding tight and they're not being used, they're just being held contracted.
Yeah.
And so, you can have huge, great big muscles, and only about 30% of them in some cases that you're actually able to use at any one point, because the rest of it is just being held contracted.
Yeah. Yeah. Because I know this is probably some kind of funny video that was being shared some time ago. I saw it, that all the bodybuilders who can't bend, because they are they've only built it in a certain way. They're not necessarily the most flexible people. But it is knowing that, and also we know that flexibility is also related to, like how you are aging. So in order to age well, the more flexible you are, it is better for you. And of course, you need some strength as well to support that.
Well, that's the thing, is that increasing your flexibility will naturally increase your strength anyway, because you have more of your muscle you're able to use at any one time.
That's what I thought. Yes. Yeah, because most people because there is so much discussion right now about strength training, especially with postmenopausal women, because I do see a lot of women in that age range, even during trying to get pregnant, and that side as well. So there is so much discussion about strength training. So, but if you're doing that without flexibility, it is, not going to help you in the long term, right?
No. You can build up your strength and build up your strength, but without flexibility, you're limiting how much strength you can build up.
Right.
And so personally, I think that working on flexibility alongside strength means you get a much better benefit from from training both of those areas.
Yeah. No, that's a great clarification, because it is just everybody who's doing one kind of exercise, because always people say, oh, but I walk so much. And I normally say, okay, yes, but walking is one kind of linear exercise. You need to do something else also, flexibility wise, stretchability wise. So mixture of exercises you would recommend as well, right?
Yes. Well, I think this also plays a part in something we hear quite a lot, particularly when you get sort of people go on TV shows and they'll talk about how you need to be moving, and that will help with low back pain and all this sort of thing. And people tend to react with, well, I go and I play football, once a week, or I do a lot of walking. And the thing is that the parts of your body that are moving aren't the parts that need to be moving to prevent that back pain.
Right.
So, for instance, if you're walking, you're mainly using, your legs, your arms, but your torso is going to stay fairly still.
Yeah.
So unless you're actually moving the torso itself, moving the pelvis around, moving the lower back, moving, sort of the spine itself, then you can move that as much as you want, but the areas that you want to actually get movement aren't going to be being helped.
Yeah.
And so this comes in with sort of fertility and rejuvenation, is that particularly, sort of post-pregnancy or sort of going into menopause, that sort of thing,
Yeah.
and wanting to help your body to sort of move more and to be more comfortable to be in. This is part of the reason why I think so many people have sort of moved into yoga and this sort of,
Yeah.
yoga and Pilates, is because it's things that teach you how to move your spine more often.
Yeah.
Because, it becomes very easy to simply move the rest of us around, and we're doing that within the scope of how our body allows us to move.
Yeah.
And so if you're not challenging that and giving yourself that sort of wider range of motion, it becomes much easier for a problem to occur because the brain thinks that things are moving much further than they are.
Yeah. Yeah. So from your perspective as an osteopath, what kind of how much exercise and what would be the ideal things you would include in that?
So as far as I'm concerned, the ideal exercise is the exercise that you find most enjoyable.
Yeah.
It's the exercise that you're most likely to do.
Yeah.
Because the key thing with exercise is that if you're not enjoying it, it becomes a chore, and then you give it up because it's not enjoyable. You're having to force yourself to do it.
Yeah.
So the most important exercise you can do is exercise that you enjoy doing. Now, from that point, we need to have a few more specifics.
Yeah.
And so, crucially, warming up and warming down with stretching and moving the body to take you from that sort of mental position of, I'm, break of the day, I'm about to do exercise. And we need to prepare our body for that sort of shift in paradigm. And so that comes into flexibility. So that's doing stretching before you go to start lifting weights in the gym.
Yeah.
Or it's going for getting your heart rate up by doing a little bit of a jogging before you do a cycling, before you do a spin class, and that sort of thing.
Yeah.
Because we want to basically gear our body gradually through those changes. But crucially, once we get to the end of exercise, we want to make sure we're warming down as well. So that again means gentle stretching, things that will lower the heart rate down slowly, and things that will take the muscles that you've been using quite a lot for the last however long you've been doing your exercise.
Yeah.
And will help to relax those muscles back down again, so they're not going to be contracted and tight. Because you've used them a lot and the body's gone, oh, we need to use these, contract, relax,
Yeah.
contract. Oh, we're not using them anymore. Okay, I'll just leave them like this then.
Oh, so yes. And so generally speaking, and there may not be a number, and of course it's subjective to everybody's health and how their muscles are. But generally, if somebody has done, say, exercise for 5 minutes, how long does muscles take to relax? What is the wind down time for muscles?
If you've been doing a lot of exercise for 5 minutes, it will take about half an hour for your body to completely sort of relax everything back down again. Now, obviously, with stretching, we want to be stretching for a minimum of about 90 seconds.
Yeah.
Because that's the sort of transition period where your brain will pick up on what you're trying to do. But in terms of what your muscles are doing, what your brain is doing, it takes about half an hour for the body to sort of transition between states. So if you're doing 5 minutes of exercise, you want to be doing about 2.5 minutes of stretching.
Yeah.
If you're doing a 30-minute gym class, you probably want to be doing about 10 minutes of stretching and cooling down. We want a fairly sizable chunk of time if possible.
That's right. Yeah, because I just, as a rule of thumb, I normally say if you are doing any exercise, or even with yoga, for example, if you have done a posture and then you hold that posture, and generally ideal time is about 90 seconds. If you can hold it for that long, not all postures you can hold, and especially definitely not in the beginning. It's only when you get to intermediate or advanced level you'll be able to hold it. But then to relax, at least double the time. I always say that if you have held the posture, say, for 90 seconds, then double the time that you need to give to your body to relax. So that's something.
That's a good sort of mindset to be in.
Yeah.
It can, be a little bit limited by, life in general, and having to, if you're doing a spin class, you can't then sit around for an hour afterwards trying to get everything to relax back down again. And so, for convenience sake, warming down tends to be done in a sort of shorter time frame.
Yeah.
But yes, ideally, as we've been saying there, if you are going to be doing stretching to calm things down, you want to be stretching for a minimum of 90 seconds, ideally.
Yeah. No, that is great, because that's what I say to my patients as well. And we know, but people, it's like straight, you're running and then you come back and you do other things and you don't give your
Mhm.
body that time. And that is
Yes.
where also where the injuries happen, because you're not
Mhm.
doing things correctly.
Mhm.
So, Andrew, do you use anything else in your practice, like herbal medicines, essential oils, any other
Personally, I
jellies?
don't. I don't have anything against these things. I just don't know enough about them to use them.
Yeah, yeah, okay. Because
Um,
I know some osteopaths who use essential oils, like I was mentioning to you
mhm.
about my teacher, Andreas, he used to use essential oils quite a lot.
Yes.
And I know some people who do.
Mhm. And this is the thing that osteopathy and complementary therapies can be very different depending on who you go to. And that's because people will go and they'll study more things and they'll learn more things as a
Yeah,
result. So
yeah.
a number of my colleagues, for instance, use dry needling as well. So
Okay.
they'll use basically Western style acupuncture
Hmm.
alongside their treatments. I'm predominantly an osteopath. I have a little bit of myofascial training as well, and so I use that sort of guide what I'm doing.
Right.
But yes, that's I don't tend to use other products currently, but that's more other sort of complementary things currently. But that's just because I haven't got around to
So
learning
you
more
have
about them
them.
yet.
Yes, yes. No, because I've seen, and I myself have learned kinesiology over many years ago, and which is
Hmm.
also something that many herbalists use, for example, as part of their protocol of using how they would like to use herbs.
Hmm.
Kinesiology is also, I think it's a great therapy that can be
Hmm.
used in so many different ways, how your body
Yes.
is giving its own intelligence.
I think the crucial thing to understand with all these therapies, because there are a lot of names that get thrown around with therapies, the dizzying amount to choose from. But
Yeah,
crucially, therapies aren't monoliths; they're tools. And so, I'm an osteopath, and that's just because that's the therapy that I trained in, and that's what I sort of identify as.
yeah.
But my treatment is guided by, my fascial principles, or with exercises through physiotherapy that I've learned more from that side of things,
Mm,
or even, sort of energy healing and that idea of sort of moving through. I don't call myself an energy healer.
yeah,
I don't have any, formal training in energy healing, but the concepts behind that help guide what I do as well.
yeah, yeah.
And taking bits from other places, because therapists aren't monolithic as well.
No.
Therapists are people,
Yes,
and
yes.
so everybody will treat it a different way, guided by what they um, feel works well for them and what they feel they can provide well.
Yeah, yeah,
Um,
100%. And what do you use if you are sick?
if I'm feeling sick, what I tend to do is listen to what my body is telling me.
Yeah.
So if my body is telling me I need to sleep, I will sleep. Usually, I don't tend to hydrate all that well. That's a sort of thing that I'm aware of with myself, and so I tend to make sure I'm.
Sorry, we have a dog.
That's all right. I tend to make sure I'm drinking more water.
Yeah,
Uh, if I am feeling inflamed, then I might turn to a painkiller, usually ibuprofen or paracetamol.
yeah,
But largely, if I'm feeling ill, I want to try and find what the cause of that is and how I
yeah.
can help myself with that. But usually, making sure that I have plenty of food, plenty of water, plenty of rest.
Yes.
I find are the three main things that my body tends to need when I'm not feeling well.
And how often are you not feeling well? How often is that?
Not too often these days. I'm able to sort of manage my stress a lot better.
Yes.
But I suffer with migraines and have done for many years.
Mm-hmm.
But the frequency of them has reduced quite a bit now, so I maybe get one every 3 months or so.
Okay.
When I get it, they can be quite long. I mean, my migraines can last about 72 hours on average.
Yes. Yes.
Um, so when they come along, it is quite uncomfortable, and so then I'll make sure I'm drinking plenty. I'll make sure I'm sleeping plenty.
Yeah.
I'll use ice and various other sort of natural anti-inflammatories for cooling down, particularly over the back of the neck and around the shoulders.
Yeah.
I'll use heat for sorting out muscle tightness as well.
Yeah.
Ice tends to work quite well for the inflammation. Heat works for more sort of relaxing the muscles and improving my blood flow.
That's right.
Um,
No, because I ask because practitioners have to be healthy as well,
hmm,
and also practice what we preach, what we are telling other people, if we are using it for ourselves, as well as keeping up with our own health, because
Hmm.
healers have to heal themselves. Only then you can also give your energy to your patients and
Yes.
clients.
Part of that is that, if if there is a pain or something that I'm struggling with, I go and see one of my colleagues, or I go and see one of my
Yes.
other therapists that I know. So I know a very good myofascial therapist called Dr. Sarah Bryan,
Hmm.
and we treat each other regularly to basically
Right.
keep on top of our own health.
Yes. Yes.
Or I'll go and see one of my colleagues in one of my clinics, if they've got time to if they've got time to see me on their calendars. I'll book an
Right.
appointment
Yeah.
for myself.
Yeah, yeah. I mean, that's wonderful to be able to, rely back on your own colleagues as well to,
Hmm.
of course, use the same therapy that you're using for everybody else, and how it helps you, and keeping yourself fit. Uh,
Hmm.
so tell me, what is that you are doing, something that you're looking forward to doing more of, in terms of your practice? What kind of patients you see, men, women, children?
So I tend to see quite a lot of at the moment. I see quite a lot of women, particularly in sort of office jobs.
Yeah.
Typically, sort of between 20 to 70, so quite a wide range. Usually adults when they come to see me, but I do treat children as well.
Hmm.
I do treat elderly people quite a bit as well. But what I'm enjoying treating quite a lot of at the moment is that I'm getting quite a lot of head and neck and shoulder pain. These sort of
Hmm.
we call them upper cross tension problems, which is that sort of from the head down across the shoulders,
Yeah.
into the mid back.
Mm.
And part of it is because various desk setups that have, working from home desks that have been set up during COVID and
Yeah.
haven't changed since then.
Yes.
Uh, well, people are they're beginning to get back into sort of normal life a bit more, or they're looking down at their phones a bit more. They're looking down. A lot of what we do tends to involve a lot of looking down these days.
Looking down like that. Yes. Yes. Yeah. So what is your remedy for that? Because I normally, I constantly keep doing this so that I stretch my neck,
So
because
I
it
find
is,
one of the movements that we don't tend to do is that a lot of movements tend to bring the head forward off the center line.
yeah.
And so when you then, go and look up from there, your head's already forward on that center line, and the look
Mm.
up is happening from there. So the muscles at the back of the skull don't get used all that much. So what you do is just put your fingertips against the back of your head.
Mm.
You tuck your chin downwards, and you're going to push your head backwards.
Ah, okay.
That's it.
Hmm.
So you're trying to give yourself a bit of a double chin.
I already have some. Yes,
And
I got
again,
it.
holding that for about 30 seconds, just lightly against the fingertips so you can feel the muscles working.
Yeah.
That's one of the main exercises that I tend to give out to pretty much everybody, because it helps to stretch out the muscles that get caught up at the back of the skull,
Yeah.
and it helps to reposition the shoulders a little bit more,
Yeah.
because a head is a very heavy thing.
It
The
is.
average human head weighs about 5 kilograms, which is easy enough when it's upright in a sort of neutral position on top of your spine. But if we
Yeah.
take that forward, the amount of weight that the neck is having to deal with increases dramatically.
Yeah.
So that a 45-degree tilt forward
Mm.
means the neck is having to hold up 22 kilograms of force. It's having to deal with 22 kilograms of work,
Yeah.
rather than just being the sort of 5 kilograms from before, which is a huge increase.
It is. Yeah.
It's same as having 39 iPads hanging off your neck, 1,573 pieces of sushi,
Oh
or
my
my
God.
personal favorite, which is a baby
You.
polar bear on the surface of the moon.
Yeah, you seem to have counted it, or somebody has.
Yes,
Um,
I've done quite a lot of sort of write ups on this previously, because
right.
it's an area that I find so fascinating. Because we don't think about the weight of the head for one thing,
Mm.
and we don't think about the head's position very often.
Yeah.
And if we think okay, 5 kilograms, oh, that's quite a lot already, but 22 kilograms. Personally, I
That's
find it quite difficult to put weight into context. And so having
yeah.
something I can contextualize that to tends to work quite well for me. And so
Okay.
from there, I was thinking people don't tend to identify with numbers all that well. People identify with 39 iPads or small baby polar bear on the surface of the moon
True.
because it's something that makes you laugh and it's something that is a bit more memorable.
Gets your memory going or your mind going a bit. No, but
Yes.
it's an important point because I was saying this to patient of mine was doing Ayurvedic treatments and at the base of the neck, and I was just massaging there. She said, "Oh, this feels so wonderful and relaxing." I was telling her that head is the most heaviest part that we have, and it is only
Mm.
relying on, as you just explained, on that portion and can get really tense.
Mm.
So how to release that and how it is, that's why it is feeling so wonderful, because most people don't do anything with the base of the neck. No.
No, most we don't tend to think of the base of the neck as a problem. So
Mm.
when people say that your head should be backwards, people tend to then naturally tilt their head backwards,
Yeah.
or they'll tilt their head forwards. But the neck itself is staying in the same position. The only
Mm.
bit that's moving is the skull on top of it.
Yep.
And so
Exactly.
actually, this is what I was saying before about specific movement for the body. That if you're not moving the neck itself, you're not getting the benefits of increasing that range of motion.
No. No.
You're still working within the range of motion that's causing you problems.
Exactly. Yes. I mean, that this is what we are talking about, to be more specific, to talk about the specifics, to talk about what, and again, even within that, it will change so much if somebody is really slim, if somebody is, much
Hmm.
more bigger person, and how their overall probably posture is, and what kind of sofas they sit on, what kind of chairs they sit on, what kind of lifestyle otherwise they have, what kind of car they drive, because some cars
Hmm.
are very low cars,
Yeah,
and
so the
you.
position that our bodies go in day to day is a huge factor on what our bodies will be doing and what they're able to do.
Yeah,
Um,
exactly.
so part of what I do is that I study how people move. I study how people sit in various products. I study how various things are done,
Mm,
because understanding that movement gives me more that I can work on with patients.
yeah,
So if I know that my patients keep their saucepans on top of the fridge, then I know that when they're doing that, they're most likely going to be lifting and tilting their core backwards rather than lifting their hands up to put a saucepan on top of the fridge,
yeah,
which will change person to person. Or if I know they're driving an automatic car, I know their left leg is going to be staying still and they're going to be
yeah,
tilting through their right side as their right leg's doing all the work.
yeah.
Or if they have a larger car, when they get out of the car, they're going to be stepping down with that right leg
Mm,
rather than pushing up from the right leg.
yeah,
And so these little things, these little changes that our body does day to day will have a
mm,
massive impact on what your body's doing,
yeah.
because we're doing these for 24 hours a day.
Exactly, exactly.
I think
No,
there was a figure a little while back, which might be a little bit out of date now with a sort of post-COVID, but the average person would spend up to 9 hours a day seated,
mm,
which is the same as flying from Heathrow to Cuba. Imagine if you're doing that distance every day. If we're going on a flight for more than 2 hours, everybody knows, oh yeah, you get up and you walk up and down the cabin
really,
to
yeah,
stop yourself getting deep vein
yeah,
thrombosis. We know that sitting for that length of time isn't a good thing for the body, or it's not an ideal thing to be that still for that length of time.
yeah, yeah.
And so if you're not going to move the body, it's going to cause problems.
Yeah, absolutely. No, this is wonderful, and that's I love the beauty of different therapies and different paradigms and what they can do for you, and how learning, even if you have, I don't know, one session with you, you can learn something forever. You know,
Hmm.
which is what I always say with my work that I do with natural medicine, herbal medicine, Ayurvedic medicine, is that if you have a consultation with me, you're learning about your personality type, you're learning about the kind of foods that are suitable, not suitable for you. This is an information that you can use forever, because
Hmm.
it's going to be beneficial for you once you learn it that way. And that is what I say to patients also, to learn it from the practitioners, because
Hmm.
most of the time people are like, no, somebody mentioned it or somebody said that, which is such a random advice. Why would you take that advice on board,
Hmm.
without knowing your full medical details, without knowing your full
Yeah,
body.
crucially, if you go to your practitioner and they give you advice, that is going to be advice that they've decided to give you based on what they've seen of you specifically.
Yeah,
And so advice that can be that specific will be much more useful for you than advice that is for the general population, because there isn't such a thing as an average person.
Exactly.
Everybody is an individual, and trying to give advice for general population, you maybe get about 60% of the population if you're lucky.
Yes, exactly. So that is wonderful. Thank you so much. I mean, we, as I always say with every guest, you can carry on, we can carry on talking about all of this because it is just wonderful. I also feel body is such an amazing instrument, how the body is designed and how even to feel about how muscles and everything is working is just such a fascinating thing. And to know that you can work on something tip of your toe and it's actually working on the back of your neck, or you work on the back of the neck and it's actually helping the tip of your toe, which is the how the body works. But thank you for sharing your knowledge and your expertise with us, and thank you for coming on the show, and I hope you enjoyed
Thank you
it.
for having me.
And yes, we can certainly talk more next time when we do, but thank you, Andrew, for your time.
Thank you.
Bye bye everybody, and thank you for your questions. And I